We ready? 3, 2, 1, go.
You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast.
Okay. All right. Hey, everybody. Welcome back to another episode of the NeuroRESET podcast. I'm Dr. Teams. We're sitting here at Desert Brain and Spine, and we are with a very special guest, actually somebody that we refer a lot of patients with, and just have a good synergistic relationship with this gentleman. This is Skip Albright from Skipnotherapy, or a hypnotherapist, and it was actually, I was referred to Skip for not only referring patients, but also myself through Jennifer Sosnowski. So Dr. Sosnowski, she sent some patients over there. So that was our connection, and that's been, at least a year at this point. I think just over a year, but I think I've been sending you to patients longer than that. So welcome to the podcast. Thank you for doing what you do.
Thanks for having me.
So what I want, the things that I tend to run into are patients are, oh, well, is it like hypnotherapy like we see on TV and stuff like that? So I'd say first tell us, why don't we get that debunked, and then we'll kind of dive into the story about like what really got you here and things of that nature and what we look for.
Well, what you just said is what I typically hear and what most people think about hypnosis, because most people get their understanding of hypnosis or hypnotherapy from TV and movies. Think movies The Manchurian Candidate or Jordan Peele's Get Out or Office Space has a hilarious scene of hypnosis in it where the hypnotherapist dies in the session or has a heart attack. And those are all, I call that simply a mischaracterization. It's really not based in fact. It is a caricature of what hypnosis is. So hypnosis really, if you read anything about hypnosis, most of the common definitions, at least part of the definition includes the phrase that it's an altered state of consciousness. That's true. Hypnosis is an altered state of consciousness, but so is getting drunk or getting high on drugs. So it's not specific enough, and I like specificity. I like accuracy. So when I work with clients and I'm explaining hypnosis to them, I tell them I define hypnosis two ways, and these are my definitions of hypnosis. Visualizing with feeling, so you're applying a visualization to an emotion, which happens all the time, and I can explain that in a little bit. And the second way I define it is doing one thing and thinking about something else simultaneously. A quick explanation of that. How many times do you drive down the road in your vehicle and you're thinking about something other than the physical act of driving the vehicle?
All the time.
All the time.
Yeah.
You might be thinking, where am I going to get lunch? Or, I have to stop and pick up some groceries on the way home, or whatever it is. You have these extraneous thoughts. That is a form of hypnosis that we often hear called highway hypnosis, and people can really identify with that. They say, I showed up in my driveway and I wondered, I didn't remember passing the shopping center, or I'm driving down the highway and I went right past my exit because I was so engrossed in thought that I missed it completely.
And most people say, well, I wasn't paying attention, right?
Right.
And so it's not that you weren't focused on the wrong thing, you're just focused on something else.
On something
right?
else. That's exactly
like
right.
a runner's high is another example.
Absolutely.
And
You're pumping all those endorphins through your body and you get that high when you're running. Yeah, absolutely. A little bit different than what hypnosis is. But so really, if you think about that highway hypnosis, what's really going on there when you're driving down the road and you're thinking about something else? Yet you don't crash into the person in front of you. You don't drive off the side of the road. And what's really going on? If an exigent circumstance comes up, the guy in front of you hits his brake lights, you'll bring your conscious mind back into the process of driving, and you'll take the appropriate action, hit your own brakes, steer out of the way, whatever it is. That's a form of hypnosis. How many people are reading something, a book, a magazine, you get to the bottom of the page and you don't remember what you just read. Yet you know you were reading because you're already on the last word on the bottom of the page. How do you not remember what you just read? Because your conscious mind was distracted, thinking about something else. Something in that last paragraph may have grabbed your focus, your attention, and so you were thinking about something else. Science says we all go into hypnosis as human beings, first of all, at least 40 to 60 times a day, which many of my clients that come to see me are flabbergasted by that. What are you talking about? We go into hypnosis all day long. Science says we all go into hypnosis in the first few minutes before we fall asleep, the hypnagogic state, and in the first few minutes after we wake up, called the hypnopompic state. And what I try to get my clients to understand is it's a natural, organic process. It's not weirdness, it's not voodoo, it's not magic, it's not witchcraft. And a lot of my clients that come to see me who have never experienced hypnosis before think it's going to be something. A lot of them have religious objections, and they say, well, my religion says that hypnosis is allowing you to open yourself up to evil spirits or forces. And I say, that is ludicrous. I understand where that comes from. There are a lot of religious tenets that defy logic, but that's not true because we all go into it. It's a natural, organic process. So that's what hypnosis is.
So you're talking about the conscious turning on and off. Talk a little more about the subconscious.
So the subconscious,
that's part of the training, right? As part of what you do, you have to educate people on what the subconscious does.
And
right?
I do that every time I have a new client in my office. I do, a 45-minute, 60-minute explanation about the conscious and subconscious minds, because I want them to understand this is not, you're not going to, what most people think, be led into a state where you're not going to remember what happened or you're going to be made to do something silly. Think stage hypnosis.
Yeah.
And that's real hypnosis. People say, well, are they just stooges? Did that guy just use them and they agreed to act silly when he suggested something? No. They probably anticipated they were going to do something silly, but that's part of the whole shtick. If you're at a carnival or a state fair or whatever it is, a high school gym pep rally, or they bring somebody in, or whatever it is, an assembly, they bring that in for entertainment value. That's exactly right. But that's really hypnosis. So what goes on, as you said, the subconscious mind. So we have a conscious and subconscious mind. The conscious mind, logical, rational, analytical, very judgmental, very present. So people who say, I'm a very left brain thinker. We hear that all the time in our society, right? In our vernacular. What they're trying to connote is, I am logical, rational, analytical. I like facts and figures. I don't care what people's opinions are. I want to see sensory proof that something is real. And so that's what they value. And you think, typically in our society, what are left brain thinkers? Well, doctors, engineers, accountants, people involved in math and sciences, people who really like those facts and figures, and it's great for their professions, right? They use it, that accuracy, to be able to further whatever it is they're doing. But then there's a subconscious mind. And by the way, that conscious mind, according to science, gives us the ability to process about 2,000 bits of digital information per second. That's the conscious mind, what it can focus on. How much is 2,000 bits of digital information? Unless you're a computer engineer, that might elude you, right? Oh, and I get some clients, I'll tell that to them, and they, oh my gosh. I say, don't go getting impressed. Because the subconscious mind processes, according to science, 6 to 8 billion bits of information per second. Do the math. Divide 6 to 8 billion by 2,000. It means your subconscious mind is 3 to 4 million times faster, more powerful than the conscious mind. The subconscious mind, where the conscious mind was logical, rational, and analytical, the subconscious mind is creative, artistic, and imaginative. So people who say, I'm a very right brain thinker, that's what they're trying to connote. I like creativity. I like to be able to take control over what it is I'm producing. Typical writers, poets, artists, designers, it's involved in everything. In your profession, you use creativity when you're thinking about a novel approach to be able to treat somebody, right? Or you're culling together various disparate parts of your practice and education experience to treat somebody.
Like you take all the data, all the analytical stuff, and you take the person in front of you, you have to dissect that. So they say you can't teach a lot. There's certain things you can't teach, right? And
Right.
that's where that subconscious
A
comes in.
lot of that absolutely comes
Yeah.
from that.
Yeah, and so it's just the experience, right?
Yes.
Which we'll get to at some point, because
Yes.
experiences can sometimes be positive, sometimes they can be negative, and that's
Absolutely.
where trauma comes in, right? So I want to touch on trauma later,
Okay.
later on. So
Sure.
keep going. Sorry to interrupt.
No problem. So we have a conscious mind and a subconscious mind. Now, from my understanding, you'll say, well, the subconscious mind has far more effect over our lives than the conscious mind does. Well, not necessarily true. It's true in certain aspects. That subconscious mind runs our physical body, what we call the base subconscious. You don't have to tell your heart to beat, and yet it's been doing it many times a minute from the moment you were born. You don't have to tell your lungs to process air, or your pancreas to produce insulin, or your hair to grow, or whatever's going on. That's all run almost automatically by the base subconscious, whether you're awake or asleep. Very useful, what we call the base subconscious. But then there's a second part of the subconscious mind called the intermediate subconscious. I call it the information manager. And it organizes and stores all your memories and emotions. It's been doing that since you had memory at a very, very young age. Science says that our subconscious minds are essentially a 6 or 7 year old kid. They never evolve beyond that. The conscious mind is chronologically up to date with who you are. The subconscious mind is not. And that subconscious mind never forgets anything that's anchored in the subconscious mind. And what gets anchored in the subconscious mind? Any thought that has a strong emotion to it. And the stronger the emotion, the more strongly it's anchored in the subconscious mind. So let's say you're 5 years old and you're walking down the street and you see a person walking down the street with a dog on leash. And you say, look, Mommy, a doggy, can I go pet the doggy? She said, sure, go ahead. You go over there and you bend down to pet the dog and the dog bites you on the hand. That dog just created a hypnotic effect, because hypnosis really at its core is two things: creating an emotion and offering a suggestion. That dog just created an emotion when he bit you, fear, likely, right? And he offered a suggestion: dogs are dangerous. Your subconscious mind, because you anchored that strong emotion of fear in your subconscious mind based on that event, your subconscious mind will never forget that unless or until you change what we call reframe that thought. You're going to have that fear anchored inside of you. So let's say 50 years later, you're walking down the sidewalk with a friend of yours, and here comes a dog running up the sidewalk off leash, and you start freaking out. Like, oh gosh, Bob, look out. Watch it. This dog's probably going to come over here and bite us. And Bob's like, what's the matter with you? It's just a little dog. And he bends down and he pets the dogs. Hey, boy, how you doing? You didn't do that intentionally. Your subconscious mind, which is your protection mechanism, invoked that memory of that fear, and you felt the same physiological response in your body that you did when you were 5 years old. Maybe in your chest, maybe in your stomach. And I tell clients all the time, every emotion has a corresponding physical sensation in our body. Every one, whether it's a good emotion or a bad emotion. You think about somebody you like or love. And remember, I'll tell married clients of mine, you know, you remember when you first met your husband and it was a half hour before he was going to come over and pick you up and take you on a date to a movie or dinner or whatever, and your heart was fluttering. You were just so excited about it. That's exactly what I'm talking about. You can feel it in your chest. So I test clients all the time about where in their body they have certain emotions anchored. Let's take claustrophobia, a very common issue that I see clients about. And they come to me because they're supposed to have an MRI and they say, I can't do it, or I want to get over my fear of flying and I feel claustrophobic when I'm in the cabin of the airplane, or wherever it is.
Yeah.
And I tell them that is simply anchored in your subconscious mind. At some point, they had an experience in their life that led to that emotion, that fear of being in enclosed spaces. And it doesn't matter. I've had people who experienced that at 5 years old. I had a client, I tell this story a lot, a client of mine when I was doing hypnosis in another state before I moved here to Arizona. And a woman came to me, her doctor referred her to me. She was supposed to have an MRI. She told her doctor, I have claustrophobia so bad there's no way I'm going to have an MRI, go into that tunnel and have that ceiling be right here. She said, I'm going to lose my mind. I don't want to do that. And many clients say, well, why didn't they offer her an open MRI? Well, they didn't. I don't know if they didn't have one at that facility, whatever it is, but they didn't. And she said, well, I'm not doing it. And she did not want to be medicated or anesthetized. And her doctor said, very important I get these images because you've got some significant health concerns. So he sends her to see me. She's in my office, and I asked her one of the first questions, well, how long have you had claustrophobia? She said, oh, all my life. I said, no, you weren't born with it. When did it start? She said, oh, I don't know. I never really thought about it like that. And I asked her, I said, so while you're in here today, if you can think of a time in your life, and the earlier in your life, the better, you think it's the first time you ever experienced claustrophobia, please let me know. It's important. She said, okay. I said, in the meantime, how does claustrophobia affect you in your daily life? She said, I can't ride in elevators. I walk up to an elevator, my heart starts racing, my blood pressure elevates, my knees get weak. No way I'm ever going to get in an elevator. Anything else? Yeah, now I can't even fly. I mean, I love to travel. I get in an airplane, and that flight attendant closes the cabin door, and I think, oh my gosh, I'm trapped. I can't get out of here. Well, we all are until they land the plane and open the door, but we don't all freak out about it. But she does because she has significant claustrophobia. Anything else? Yeah, MRI machines, small rooms with a lot of people in them, like a house party, something like that. It just amps me up. I got to get out of that situation. I have to extricate myself from that threat. I had been talking to her probably an hour, and she said, you remember, you asked me if I could remember time. I haven't thought about this memory in decades, but I remember like it was yesterday. I said, tell me. She said, so I was probably 5 years old, maybe 6. I had 2 older brothers growing up. And one day we were out in the yard and we were playing, and we had a sleeping bag that we were using like a fort or a tent. And at one point, one of my brothers told me, get in the sleeping bag. And I went in there, and my brothers tied the top of the sleeping bag closed with a rope. Well, I'm the oldest of 5 children. I know sometimes you get kind of
Carried away
when you're an older brother.
Yeah.
I said, how did that make you feel? She said, it scared me to death. I mean, it was dark. I didn't know if I was going to be able to continue to breathe. What do you know about air passing through fabric at 5 years old? And my brothers were out there laughing. I said, well, of course, they were laughing. It was hilarious for them to see a sleeping bag jumping around, but not for her. I said, how did that make you feel? She said, I was scared to death. I said, where are you feeling this? She said, right here in my chest. There is where her subconscious mind had anchored that feeling of claustrophobia, right in her chest. The same place that she identified where being in an airplane, being on an elevator, being in an MRI machine, or in a small room with a bunch of people in them, it's consistently there, which is exactly what I was looking for. So in other words, every time she's in one of those threatening enclosed environments, she's viewing it through the eyes of a 5-year-old girl, which is the age at which she introduced that, what we call an ISE, an initial sensitizing event. That's what started claustrophobia for her. So all I had to do was change her viewing point to this educated, mature, successful 35-year-old woman, which is what I did. 2 weeks later, she had her MRI, had no fear whatsoever, sent me a wonderful email, thank you so much. But that's how quickly and how innocently negative programming could get anchored in the subconscious mind.
Pretty cool stuff, Ree, right? It's funny. Ree's usually back there, just kind of hanging out. She's listening. This time, she's like leaning in, and that's pretty cool stuff.
It is.
So, let's see. How can I phrase this? What's something that's required for something like hypnosis to work from the patient or the client's
A desire.
standpoint? Okay.
A strong desire to create change.
Okay.
So if somebody comes to me, now, if you ask most Americans, and there are studies that have been done about this, you ask most Americans, what is hypnosis used for? Well, as long as they don't think it's, first of all,
Like an
weirdness,
entertainment, yeah.
right, or what they saw at the state fair, what they think it's used for is the top 2 items are weight loss and smoking cessation. That's what people think. They identify hypnosis. I do very little smoking cessation these days. Not as many people are trying to quit smoking these days. There's generally not as many smokers as there used to be statistically.
Thank goodness.
Yeah, absolutely. And the ones who are smokers are pretty hardened into it, you know.
They don't want to quit.
That's right.
Like they want to quit, but they don't want to quit.
Yes,
Yeah,
that's exactly right.
they're very wafty.
But hypnosis can be used to alter all kinds of behaviors. But to answer your question, the one thing, and I always ask clients, and especially in cases of something like that, quitting smoking or weight loss, hypnosis amplifies our desires. More than anything, that's exactly what it does. So if you don't have a high desire to change a behavior, well, I just like the idea of it. Let's say smoking, for instance. Let's say a pulmonologist sent a smoker to me because the person has COPD or emphysema, and they're not going to live very long if they don't quit smoking. They're still smoking, and their pulmonologist says, "Gee, Bob, I can't believe you're still smoking. You're not going to live long. What?" Mm-hmm. "But doc, I tried. I can't quit. I go 2-3 days. It drives me nuts. I got to have a cigarette." So the pulmonologist refers Bob to come see me, and Bob's in my office. And one of the first things I ask Bob is, "So Bob, on a scale of 1 to 10, telling me what you honestly believe, not what you think I want to hear, how strong is your desire to quit smoking?" "Well, Skip, you know, I've been smoking 40 years. I love smoking. I mean, I wish I could continue to smoke. I like everything about it. But my pulmonologist tells me I'm not going to live long if I don't quit soon. So maybe I'm a 4 or a 5, something like that." I say, "Okay, Bob, well, then you can go home. And when you're a 9 or a 10, if you ever get to that point, you call me up and you say, 'Skip, I'm ready to quit smoking.' I'll assure you, you're going to quit smoking because you have a high desire to change." But what would happen now, Bob being a 4 or 5, I would do what I do, relax him, which is essentially what leads us into what people describe as hypnosis. Mm-hmm. I relax him physically, mentally, and I'll explain some of those misconceptions because mm-hmm. people think, all right, now I'm not going to hear anything. I'm not going to be aware. That's a caricature of hypnosis. Mm-hmm. That's not true. I would give Bob all the beneficial suggestions to quit smoking. I emerge him from hypnosis. He thanks me, leaves my office. He goes out in his car and he lights a cigarette and says, "Well, that didn't work." I say, "No, it worked perfectly. Your true desire was to continue to smoke, remember? That's what you really want. So congratulations. Would you like me to help you be a 4-pack-a-day smoker?" "No, I don't want to smoke 4 packs a day." "But neither do you want to be a non-smoker." And there's the difference. So when you ask, what kinds of people would it not work for? People who are genuinely not interested in changing, or people who are actively resisting relaxation. And I do my level best when somebody comes into my office to put them in a place of relaxation so they're not amped up. They're coming in here thinking this is going to be weird. This guy's going to make me say things or divulge information about myself that I'm not going to remember. That's absolutely not true at all.
And I can personally attest to that, right? It's like working through and asking, you ask the questions that apply to that person's goal.
That's exactly right.
Right? And if they don't want to give them to you, then obviously their desire is not that big.
And right? I'm also looking for underpinnings that started the behavior in the first place.
Sure.
Like the girl that I just mentioned, who was in a sleeping bag at 5 years old. Here she is now, 30 years later, and she has this intense feeling of claustrophobia anytime she's in a threatening enclosed environment. So I need to know, if I would have just tried to give her suggestions to no longer have claustrophobia without digging into the ISE, the initial sensitizing event, and reframing that using visualization, likely it would have been a temporary at best outcome.
Yeah.
But because I did that, and I went back and I reframed the original stimulus, the ISE, it was a permanent change.
Yeah. Awesome. Fantastic. Yes. So one of the things I definitely want to get into, because we just talked about this recently, somebody who most patients that I send to you have some form of dysautonomia or POTS, right? POTS is kind of a big word. It's actually just Dysautonomia Awareness Month, so we're going to talk a little about that too. And so from my point of view, when you look at the functioning, because I'm a little more, in this office, it's a little more data-driven, left brain, gathering the information, looking at the testing, stuff like that. But you have to be right brain in order to synthesize and understand why it's there in the first place.
Sure.
Right? And so when we work with these people, if you look at, keep it simple, the fight or flight system or the rest and digest, it's pretty obvious that the fight or flight system is more dominant this day and age than it was even 20 years ago, right? It was still dominant because I think this is a conversation for another time. But, you know, there's things at play that create the fight or flight activation.
Yes.
Right?
Yep.
And usually there's either one thing or a repetition of things or exposure to something over and over and over that drives that fight or flight system. Vice versa, those people that we know that seem to be calm, cool, and collected, it doesn't happen by accident, right?
Right.
So when we talk about dysautonomia, it's really you can consider dysautonomia a discrepancy between the fight or flight and the rest and digest, really how far apart they are and how hard it is to go from one to the other. That's a kind of a really basic description. And one thing that I can tell you with, I'd say probably 98% accuracy is if anybody calls in with dysautonomia, they're going to have had some sort of pretty significant trauma in their history. It's weird if there isn't. Usually those cases are head injuries. So they actually screw up the physiology, then we can work with them and rehab them, and they're done within 6 to 8, 12 weeks. Something very simple, and it's just very linear road of improvement. They don't have a whole lot of setbacks. There's control over their nervous system before the head injury, so we're really dealing with the pathway, not so much like that fight or flight integration piece that's been there for 30 years, right?
Yes.
And so I always ask, you know, it's, you know, you do this long enough, you know that there's trauma, just having a 5-minute conversation with someone.
You
and
bet.
So figuring out how to pull that out and understand the intensity of that trauma is one of my goals here in the office, or our goals here in the office with the other docs as well. So is it something small that we can work around, or is it something like big enough where it's like, hey, this is going to be an uphill battle until we get to a certain point of like strength or where that desire like kicks in, and then that's when they get referred to you. And so from our point of view, there's a strength component, right? If you've had trauma, and you help me understand this if I'm wrong, if you've had trauma and activated that fight or flight response to a certain degree at a certain age, and there's been a certain amount of time that's gone on, it becomes very difficult to heal yourself.
You bet.
And so that can manifest in dysautonomia with the heart palpitations, the lightheadedness, the blood pressure changes, the migraines, the brain fog, the dizziness, the insomnia, right? How many of those things do you see? Like all the time.
All the time.
And so with our approach, granted, I was a personal trainer in my early career life, and so the concept of strengthening the brain and creating some resilience based on the physical aspect makes so much sense to me, so that when you do dive into the highly traumatic experiences, you don't fall apart when you do it. Right. And I know you've shared a couple of cases as you give as examples, that, you know, some of them can take a long time. It might even be lifelong. Our goal is just to minimize the intensity of the memories, right?
Yes.
Where other times you can just turn it around and the person can overcome it. And so I'm looking at that as the difference in the strength of the physical brain, where it allows the subconscious to finally be able to take over, right?
Sure. And both are important.
I think both are very important.
Yes.
I can only do one piece of it, right? I can do what I call it the low-hanging fruits. It's like, let's try to take some bad habits and make some better habits out of it, which is, I'd say, what you do, just little baby bites of it. And so we try to reframe, I don't like going to the store. Well, why don't you like going to the store? We go through it. Okay, well, why don't we stop saying I don't like going to the store first, right? That's like a one thing that we totally can change.
Right.
And if you can do that, then you can do the next level stuff. And so with all of our POTS and dysautonomia cases, and specifically the one I sent you recently, you know, I know that there's a reason why it was there. It's not just because she worked her tail off all the time to the bone and just burnt the candle at both ends.
Right.
Like, most people can sustain burning the candle at both ends unless their candle was already short to start with, which is, I think, what was going on in this case. I wasn't able to get to the root of what that trauma might have been, and you were able to do that. And so that was very, very effective. And I can tell you, I just saw the person today, and even though they were going through and finalizing some BS that was going on in their life, they're like, I actually handled that fine. It was a different issue that caused that flare, and they knew it that fast.
You bet.
So they're like, this was different than the one before.
Yep.
So I'm super grateful for situations like that. By the way, for anybody that's listening, we do these intensives where people come in from out of town, and we'll actually see them daily for usually about 3 weeks at this time. The worse someone is, the longer we might see them, up to maybe 4 or 5 weeks. This person is able to do that, and we're going to do that. So I had a report as of this morning that even though they had a big flare over the weekend, they're still upwards of 50% function, and they showed up at 10%. And so I think anybody that's talking or thinking about coming in town for this, that's where we had a conversation. I'm like, look, I'm just going to schedule these people with you either week 2 or week 3 after we get some of that strengthening piece.
You bet.
And it's been, so far, it's really, I feel it's been like a knockout in terms of letting that, like getting the result for the patient.
You know, you said something that I want to touch upon, and it's very important when you're talking about fight and flight. We actually have 3 of those protection mechanisms, as you well know: fight, flight, and freeze responses. Freeze, allegedly the newest of those. And I like to think of it as, imagine we're cave people, however long ago that happened to be. And we had big animals looking to us as their food source that are going to come try to eat us, or other clans of cave people with clubs and spears coming to take our resources. Hey, it's easier than finding their own. And we had to figure out, how do we protect ourselves? If we didn't figure out how to escape or protect ourselves from those large animals, we, good chance, would have been wiped out as a species long, long time ago. But up here in the newest part of the brain, the prefrontal cortex, we developed these fight, flight, and freeze responses to be able to protect us. And that's absolutely necessary. That is a huge part of what the subconscious mind does in human beings. So fast forward to today. Let's say we have a 5-year-old boy and he's playing on the beach. He's sitting in the surf all by himself, right? Mommy's back here on a beach towel, and here comes a big wave, and it's bigger than the rest of them, and it knocked him over and went up his nose and in his mouth, and he's crying and screaming, and mommy runs over and picks him up and takes him back to the beach blanket. That was a traumatic event for that little 5-year-old. It created a strong emotion, fear, again. And that anchors in the subconscious mind. Between the conscious and subconscious minds, we have this thing that we identify as the critical faculty. And essentially what that is, according to science, is judgment, which science says we don't develop until we're about 6 or 7 years old, which is not coincidentally the age at which
We refer back to, right?
that's exactly right. So this little boy now has a fear of, well, why don't you go back into the water, Tommy? No, I don't want to go to the beach. I don't ever want to go to the beach again. It was a misunderstanding by his subconscious mind. Now, how many people go to the beach and go in the water? Well, millions and billions of us, right? And is it a threatening thing? Not usually, unless there's a shark or you're in water over your head or you can't swim. Most of us can wade in up to our waist, and it's refreshing and all that. But that little kid had a misunderstanding about water. And now he thinks beaches, because it created this strong emotion. So that thought attached to that emotion bypassed that critical faculty between the conscious and subconscious mind, and it anchored in the subconscious mind, where it will remain unless or until it's changed, reframed, as I mentioned earlier. Well, what empowers it to bypass the critical faculty? Emotion. So any thought that has an emotion can anchor in the subconscious mind, whether it's a good emotion or a bad emotion. You think about something and it's a pleasurable experience for you, that's because your history tells you you applied a strong positive emotion to it. But what else does the other thing? When I said about the dog, and 50 years later, you're walking down the sidewalk and here comes a dog and you're scared out of your mind, you didn't do it intentionally, but your subconscious mind never forgot what happened at 5 years old. Somebody might look at you and say, come on, man up. I mean, rub some dirt on it. Get over it. It's just a little dog coming over here. What are you losing your mind about? You didn't do that. That protection mechanism, fight, flight, and freeze response kicked in, and you're going to do whatever you think is necessary in order to protect yourself. And that's exactly what happens.
So physiologically, when we have that fight, flight, freeze, right?
Yes.
We can call it the logical side and start talking about what the polyvagal theory, which is where they describe this a lot, right? So we start in that freeze state, right? There's a loud sound, boom, we freeze, and then we scream, right? So it's one or the other, right?
Right.
And so as we develop into, what do they call it, the terrible twos, is where you start developing your sympathetic response to like take action. You run away, you say no, all those things, right?
Yep.
Then as you continue to grow and you hit what's called the ventral vagal, is probably, I'm guessing, around that 6 or 7 year old, where you develop the judgment and you say, hey,
Correct.
the ability to reason with your emotions.
Absolutely.
And you say, hey, that's actually not that bad of a thing.
Yes.
But, or hey, stranger danger, that's going to be true for as long as I,
Yes.
whatever it might be.
You bet.
And so as you're going through there, if you're looking at it as a scale, so if you're on YouTube right now, I'm just kind of moving my hand up and down with the dorsal vagal, or the stuff we're born with, and then as we build our experiences, it makes its way up to the ventral. You're always oscillating, usually between two of those that I've found. So if if your system is so bad, or you've had so much trauma that it's put you into that freeze state, you're either going to freeze or fight.
Yep.
Right? Or you're only frozen. If you start to fight, you're actually getting some improvement, which we've seen in some cases. They start to get mad, they start to voice their opinion, and on their way to ventral vagal, which, by the way, I call ventral vagal happy hour, because it's like most people are pretty happy at happy hour. So,
Sure.
So it's just a relaxation concept to put to the data of the ventral vagal.
Yep.
Is all I use. So as we're looking at that, I'm thinking, okay, what do we need to strengthen in order to get this person out of freeze to the sympathetic mode, which is, in this state, it just means you're taking action, right? Doesn't mean you're running from a bear, but you have the ability to take the action and run from a bear if you can reach that state. Otherwise,
right.
you're frozen on the ground.
That's right.
So as we're working through this, and from a freeze state to, well, as we look at the case, we try to create the easiest but most effective training program to strengthen the brain to get from the dorsal freeze or the sympathetic up to that ventral vagal or happy hour, right? And so, like you said, you've got to have a desire, one, and two, you kind of got to practice it, right? It doesn't just happen overnight.
That's right.
You can't tell
It's
the
not
smoker
magic.
to quit,
Right.
and then, oh, I'm all done. If they replay, I would love to keep living in years and years and years, then of course they're gonna gravitate more towards that, and that's
Yes.
what's going to create that desire, right?
Yes. A couple things that are salient at this point. People's desire to change, yeah, absolutely important. But as you know, and one of the reasons that you and I do a team approach, when you have a traumatic experience, as I said, it leads to a physiological response in the body. And as long as that's there, that reaction that you have to some stimuli, external stimuli, is always going to be there. What very often happens is it results in physiological changes in the body. Chronic pain, autoimmune disease, fibromyalgia, lupus,
Yeah.
reflex sympathetic dystrophy.
Science by itself has shown that when you have autoimmune issues, there's been a high association with trauma.
That's exactly right. So I get people that come to me and let's say they have chronic pain and they want to change something. It could be back pain, joint pain, whatever, and headaches. And they're saying, I've been everywhere. I've tried everything. I've been to every doctor. I've tried everything I can think of, and nothing's working. I've been on medication. I've done everything, and nothing's working. To me, there's a really good chance that it did result from some form of trauma. And so I do a diagnostic interview, get into that, figure out so what could have started this? Well, how long has this been going on? And did something happen around that same time, and on and on and on? Like, you know, I was bit by a dog when I was 5 years old. Okay, no wonder you're freaking out. That kind of stuff. Hypnotherapy is so effective. In the right hands, it is so effective in eradicating things like chronic pain. And people just, are you kidding me? You can help me get rid. I do it all the time. I just told you about a woman that was in my office last week who's had 3 years of chronic pain, and it was in her lats, her latissimus dorsi, post double mastectomy, and in the operation where they brought the muscles around and connected them in front to give her some mass, it led to chronic pain. She's tried all kinds of modalities to be able to get rid of it, and nothing worked. And in my office, which was her third session, it was gone. And I know some people say, okay, is that placebo effect? No, it's not. What you're doing is you're changing the way that you view that circumstance in your subconscious mind. And I do that all the time. People come to me with anxiety and depression. So we're not talking about something physiological in a
like a pain setting, right?
In a corpus setting or sense. They come to me with something else, right? It's an interpretation or a way that they think or view themselves in their life. And I find out, well, what started that? And how many people these days have anxiety and depression or fears and phobias and habits, and they want to change them, and nothing's been successful. And hypnotherapy is so successful because we change the way that you're viewing that. And that visualization, the language of the subconscious mind, is imagery and metaphor. That's how your 6 or 7 year old subconscious mind sees everything. Well, if you were going to teach a 6 or 7 year old child how to do something, one of the best ways that you can teach them is to show them. And so we're showing the subconscious mind what their desire is. Well, I don't want to have this anymore. Or I got this way because I was physically abused when I was a child, or sexually abused when I was a child, and I'm carrying around all this, and it's getting worse and worse. What I describe, if you're listening to us on something other than video, I'm making a little V at the bottom of which is the apex, and it widens out as I go up higher. The little apex of the V is where that fear, phobia, habit, whatever it was, started. Whatever took place that started the trauma. Now, as time goes on, now it involves all kinds of things. The lady that I talked to you about who was stuck in a sleeping bag. At 5 years old, it was down here at the apex. At that point in her life, she had no fear of elevators or airplanes or MRI machines. You could have taken her to an elevator that day after you pulled her out of that sleeping bag where she was tied in by her brothers, and she could have ridden an elevator and had no fear. That fear of elevators came many years later. She could have had an MRI that day, and my contention is, wouldn't have bothered her. But if you'd have said, why don't you get back inside that sleeping bag, you'd have had a fight on your hands, because that's what caused the trauma. So her subconscious mind has expanded its understanding of what's a threatening enclosed environment, and it no longer only includes sleeping bags. That happens with so many people. I know you see that in your practice. So a traumatic event, at that point, it didn't involve autoimmune disease or some kind of mental aberration. Now they're coming to me and they're agoraphobic, and they are morbidly obese, and they have neuropathy in their feet, and they have all kinds of things. Now they're type 2 diabetic, and they've had all kinds of things. Not to say that it's only coming about, if you're eating like terribly, you're going to get type 2 diabetes, that kind of thing.
Well, it's interesting because, we, in this line of work, we also, my approach is, or our approach here is like, we got to try. Even if the person doesn't have some desire or all the desire, like, can we get them to the point that they do, right? So we don't like giving up on anybody.
You bet.
That being said, I know a lot of people work specifically with neuropathy. It's a big condition, right? It's debilitating.
Yeah.
And as I look through other people who do it, I find that a lot of the things that they discuss is they're like, it's really hard to work with these people because they've done it to themselves.
That's right.
they've eaten a certain way to cause the diabetes, that cause the neuropathy and XYZ. And it's interesting that you say what you said, because whatever trauma, and this is if they listen, consider maybe referring that person to hypnotherapy as part of your treatment program, so that it creates better adherence to the rehabilitation of the physical body, while someone else manages or reframes for them the subconscious piece, so that you can actually become more successful in the recovery, right?
Because if you don't reframe the trauma,
It's probably going to
you're
happen
going to
again.
make you're going to make some temporary gains physiologically, but you're never going to. Something else is going to pop up, and it always does.
And that's one of the things that we talk about as the office, is we always want to gain, when people tell us amazing things are happening, the goal of marketing, right, is to get that on video, tape, written word, and send it out to the masses to show other people that you can help. I mean, we had a conversation last week where it's like, I have a hard time doing that on the whim, even though it's the best time to get it, because I need to make sure it's a lasting effect.
Sure.
I've heard of other offices that the moment somebody feels better, they get them on video, they tell their story, and a month later they're feeling the exact same as they did when they first came in. And so that's my subconscious, like, I don't want to do that because I don't want to fill people with false hope. And it's just so important. Like, the subconscious, every single person on the planet has one, and some are better at accessing or dampening it or whatever. You know, it's just such an interesting concept. So,
and that happens in the hypnotherapy world too.
Yeah.
So they'll have some almost what seemingly is a miraculous change, and at some point in the future, they're right back into the old neural pathway.
Old behavior.
I'm sorry?
Old behavior.
Old behavior.
Yeah.
And that's exactly what's going on. So I like to explain it. When we are doing hypnotherapy, what happens is we're changing a neural pathway or creating a new neural pathway. When the dog bit the little boy, that created a new neural pathway. He didn't have that fear of dogs before that moment, but now he does. And anything that approximates that same message strengthens that new neural pathway. So if that boy, a year later, a dog comes running up to him and he's barking and snarling and pulling on the person's leash and they're trying to hold him back, that just drove that fear even deeper. It just, to that boy, he believes, okay, that's for sure. Dogs are dangerous. I need to be afraid of them always. That happens all the time. So I liken it to this brain that we have in our head that science says we have trillions and trillions of electrical endings called synapses. And whenever you have a thought, it follows a pathway called a neural pathway. Science these days, listen to whoever you want, Joe Dispenza, all these kind of people say it takes as many as 2,300 synapses for one individual thought. But it's like connecting 2,300 dots in a nanosecond. A dog just came running up to me and he's barking at me and dogs are dangerous. For sure, I need to be afraid of them all the time. I have a physiological response, fight, flight, freeze response kicks in. I got to either run away or fight this dog off or curl up and just play dead or just freeze and hope the dog just goes by me and doesn't bite me. That's exactly what goes on. And it gets accentuated over and over again during the course of somebody's life. And they think there's no way I'm going to be able to change what's going on with me. Now, if it was physiological in nature, they had a motor vehicle accident and they were injured, their brain was broken, injured in some way, they're going to need to attend to the physiological part of that, which is exactly what you're doing, and you're changing some of those physiological responses. And then they come to me, but they still have the programming in the mind of whatever it is. Now they're afraid to drive in cars. Well, if you get them healed up physiologically, should that lead to them no longer having a fear of driving in a vehicle? Well, no, not necessarily. They still have that anchored in the subconscious mind.
That's a new one, right?
That's
like
right.
A new one.
They think, oh my gosh, I can never drive in a car again because I was in a motor vehicle accident. It could happen at any time, and I'm afraid. It gets worse and worse, as I said. It expands out, and sometimes it turns into agoraphobia or nonsensical other outcomes that you wouldn't think had anything to do with it, like physiological responses.
And it tends to be, and that's really where I would think that the anxiety kicks in, right?
Yes.
The anxiety, the
You
fear
bet.
of whatever it might
You
be.
bet.
Real quick, touching on, I think we should probably wrap up soon because we're both getting hungry. I think one thing that you said is, let's say somebody gets in a car accident, they hit their head to get a concussion.
Yep.
Well, whatever the subconscious, whatever the conscious mind did after whatever trauma, whatever the subconscious anchored, that conscious mind was injured. Meaning, so whatever you did like after a trauma and up until this point where you're like, oh, I forgot about that. I didn't have any problems. But the moment I was in that car accident, ever since that, I've had XYZ problem.
Yeah.
Well, it could have to do with the physiological damage
right.
of the concussion itself and the pathways are squirrely.
Yep.
Or it could be this old emotion resurfacing,
100%.
right?
100%.
So we have to determine what that is, because usually they end up in my office before it becomes chronic and they end up in yours.
You bet.
And so, so that's where, like, how we would play ball together is, one, we've got to make sure, I would have to make sure that the pathways are golden.
Yep.
If the pathways are good and their tolerance to, I guess, the trauma to diving in is safe, then that's when I refer over.
And we've often heard people say, I don't have any memories of my childhood. I can't remember anything about my childhood. And right away, I'm suspicious of how much trauma they experienced in childhood. So the subconscious mind withholds that from your conscious awareness.
Keeps you safe.
It's a protection mechanism.
I
Absolutely.
just had one last week. Reed, do you remember? I can't say the name, but they walked in, and it's a member of a member of a member, family member. So they're coming in like probably January. So I already told him that he's going to meet with you because I asked that question in the consult. You know, so out of curiosity, with all your health issues right now, which is dysautonomia stuff, I'm like, could you tell me? At this point, I almost don't even ask. It's, could you tell me what trauma is in your life?
Yep.
And he's like, well, tell me about your child. He's like, I don't really remember it. And I'm like, oh, how bad was it? He goes, it was pretty bad. Okay, we'll talk about that later. Or that's not my role to figure it out, and it's to refer.
Sure.
I like to know how intense it is so that I know when to refer.
Right.
Because I think the more intense something is, the stronger I have to get somebody for them to tolerate diving in. And the last piece, actually, I'm going to just throw this out. The cases best fit, in my opinion, for the rehabilitation or the strengthening phase. If you're going to a rehab therapist or a therapist of any kind, and it takes years and years and years and years, and it's like, yeah, they've helped me a ton, but they have to keep going, I'm like, okay, your resilience or your strength might not be there because you can't handle diving into the deepest stuff that's really the root cause.
Yeah.
And so that's where we've seen over the years is, as we work with the person and we strengthen that system, all of a sudden they start having those breakthroughs.
You bet.
And so it's like, that's why we always refer to some form of therapy, and we have to figure out who's the best fit for who. And so, especially with getting referrals from so many, we've got to maintain these relationships too. So if somebody's got a therapist, we work with them until they have that breakthrough, and then it's hands off after that for us.
But how long should that take? I heard Goldie Hawn being interviewed years ago, and she said, I was in therapy for 17 years, and I finally had a breakthrough.
Yeah.
And I just wanted to say,
That's way too long.
At what point
Yeah.
were you going to say this isn't working? I mean, after a year, 5 years, 10 years, 15 years, really 17 years? I would quit what I do if I couldn't help somebody in short order.
Yeah.
I mean, on the outside, 5-6 sessions, and somebody is completely different.
Yeah.
Because you have to get to the core of the issue.
Right.
If you beat around the bush, if you expect it to be an exercise in self-curing or self-awareness, the person may never get there because they don't know what started it.
Right.
And it might not be obvious to them that when this happened, that's where this started. And especially when it comes to things like physiological pain or autoimmune disease, how do you know that when my grandpa was abusing me when I was a kid, that's what led to this all these years later? And I have people in my office who are in their 60s and 70s, and they have no idea what to attribute the
correlation
issues to. And it a lot of times happened when they were young, when they were kids.
Yep, for sure. And so for us, for that time frame thing, we really try to keep keep it between like the 3 to 6 month mark or sooner or faster if we can.
Sure.
And if we can't, I always tell patients, like, if I don't want to see you forever, that means I'm not doing my job.
Yeah.
Right.
Absolutely.
And so that's why so many times in that 3 to 6 month mark, they end up in your office.
Yep.
I was like, hey, this guy is the icing on the cake. He's going to take care of the rest of it, and you're going to do great.
Yep.
Some people, and it's usually, I think, between the 60 and 80%, like when they rate their overall function in that 60 to 80% range is when it's time for me, because usually we've got to keep making that neuroplasticity, right? So we've got to be on that trajectory, and then they hit that mark, and boom, it's over to you.
Absolutely.
Like the one last week was not quite there, but it helped a ton. And so that allows us to get to the next stage and the next stage. And so they might not be 1 or 2, they might be more than that, but it all depends on the case, right? What the physical body's doing, where the state of function, and then the ability to dive in and handle that stuff, right?
And you mentioned earlier Jen Sosnowski, Dr. Sosnowski at MVP Medical. I've done that with her for years. And she'll send somebody to me she's done what she can do with them, but there's something sticky that's not changing, and they come to me and I figure out what's going on, and then they go back to her, and it's like night and day.
Yeah, and so when I say, so I think it works both ways. If we get to a certain point, everything that you do becomes even easier. On the flip side, if it's hard for someone doing something else, say medication management, working out, dietary stuff, their therapist, you come to us and we can get you to the next level, and then you go back and everything's more effective.
You bet.
So it's not an us versus them being other practitioners.
It's a holistic approach.
Where in this journey does everybody fit?
That's right.
Right, and so once we opened this clinic, it left we're going to fix you. And it's like, hey, listen, our role is to get you from here to here so that you can then do X, Y, Z. That's going to be the rest of
That's
this,
right.
And it's honestly, from my point of view, it's been a weight off our shoulders because we know that this is what we're supposed to do, right? If you hit the gym, you're going to get stronger, right? If you don't hit the gym, you're not going to get stronger, and you're going to hope for the best. And so by doing things repetitively, it's going to ensure that you get stronger. And that's like, you have to go to you to be able to do that. You have to go to us to get to the next level. You have to engage in the gym physically to get stronger. It's not going to happen overnight.
I'm working on a weight loss person, and they're eating like crap. And they're sticking junk in their face.
Or they're just like supplementing
and they want me to help them lose weight. But they're not changing anything else about their lifestyle. They're not exercising. They're not eating correctly. If you stick a bucket of sludge in the gas tank of your car, it's not going to run right. And yet that's what we're doing. We're sticking sludge in our bodies in one of these most complicated machines on earth, and we expect it to run right. So it is a combination. You have to do the team approach, a holistic approach.
Agreed. Well, I know that we can talk about this for hours on end, which we have too as well. But what I want to do is we'll see if everybody loves this, we get a ton of views on this thing and shares, and they want more. Maybe we can work on something in the future down the road and to expand on what we're doing. Awesome. Well, so I know I'm not going to get a hard stop on when you're talking about retiring, but this is also for when people see
probably
this.
A few more years.
They will be able to contact you. What's the best way to contact you?
Go to my website, www.skipnotherapy.com. It has a form on there where you can contact me, you can call me, you can text me, any way that's comfortable for you, easy for you to do, and I'll get back to you. I'm usually 2, 3, 4 weeks out, booked out, but you'll get in. It's this is not emergency medicine. You're not going to die if you have anxiety for another 3 weeks. But we're going to get going. And it's not magic. It's not voodoo. It's not witchcraft. We're going to change the way that you're perceiving things in your mind. And that's everything is perception.
Right. Awesome. Okay. Well, guys, this was a super exciting one for me. And I really hope we get to do another one. I might just have to make an appointment just to dive in again, right? Just upkeep on myself. So thank you so much for taking the time, making the trip. And I know it's going to be so beneficial for everybody out there. If you guys have any questions on maybe where you feel you might be on that journey, I know I do free consults. Do you do consults?
Yes, I do.
And so
I do
feel
free
free to reach
telephonic
out
consults.
feel free to reach out to either one of us. You can go desertbrandonspine.com, skipnotherapy.com, and let's just try to get you out of a rut, right? Let's get you unstuck and on the way towards healing. So
Absolutely.
I know we just love doing what we're
So
doing.
much change is possible.
Oh, yeah. Big time. All right, gang. Thanks for listening. We'll see you on the next episode of the NeuroRESET podcast. Skip and Doc out.